Wow, it's the Wild West on the internet. There's so much information out there, and much of it is not vetted information, so we have to be careful about what we pick up. But I think a rational, reasonable person can filter through what's available and decide or discern what's good information. I think any of the major institutions that publish vetted information is probably the best source. So organizations like ASCO and AACR and your own are really good sources of data. So I would rely on well-known organizations that have their data independently vetted. Well, there's a fundamental problem missing in patient-reported outcomes right now. Most of the PRO data, or even ePRO data, is processed in batch mode. It's not processed real-time. So for example, many of the therapeutics we have now cause an immediate response, and yet we don't measure that response often for 2, 3, 4 months. And when we capture the data, it's processed in batch mode and it's sent on for further evaluation. So we fail to anticipate emerging adverse effects or even serious adverse effects. So we need to make it real time. We need to use the ubiquitous internet and use mobile devices to collect and report this data. Yeah, I think a better educated patient means a partnership with your physician or your oncologist. The more you know about the disease, the more likely you'll be actively involved. If, for example, you understand what are the key biomarkers that your doctor is looking at, you'll be actively involved in your own care. You'll be able to measure response, whether you're relapsing, whether you're refractory to a drug. And I think these things are important in being educated, an e-patient.